It's Breast Cancer Awareness Month. Do you, as staff here at the hospital, do you notice an influx in patients coming to get screened over the course of this month just because of the increased awareness?
I think October, everybody's aware of breast cancer awareness in October. I think the JCMG does a really great job of putting that out there to the community. We in oncology, we probably don't see as many of the new lumps, bumps that the family practice providers would, or those in women's health. We're receiving those referrals from those departments once the breast cancer has been identified.
Absolutely. And for the whole month of October, obviously women's healthcare has so much research and so many blank spaces when it comes to medical research. Is there anything that you see in particular that is maybe a preconceived notion that's incorrect, or you wish more people knew going to get their screenings or doing self-breast exams?
I think self-breast exams are always important. I encourage all of our patients in the shower once a month, checking for those lumps, bumps, always reporting that to your provider. You know, when in doubt, check it out. It's so important that we are doing those annual screenings as well, those mammograms, and then follow-ups if there's some abnormality found.
Absolutely. And for breast cancer patients or people who are getting checked out, obviously there has been a increase in younger people with breast cancer. Do you think that's because there's an increase in breast cancer cases, or just people are actually starting to get screened and checked and going to get these exams at younger ages?
I think people are getting exams at younger ages. I think there's a lot of information out there, which I think is excellent. Again, if you find a lump or bump, regardless of your age, when in doubt, check it out. I also think that genetics are a really big thing, and as time goes on, we'll have a lot more information, but family history of breast cancer, you know, it's always okay to say, is there a genetic mutation in the family? Do I need to undergo genetic testing? Do I need to consider that?
And at what age did you find out that you had breast cancer?
I think I was 41, 42, somewhere in there. So I was diagnosed in 2023.
Gotcha. And before that, had you gone and gotten regular screenings and all of that?
Yeah, I had no family history, but I had started the screenings at 40 years old, which is typical. I found my lump in the shower, and then I went and I saw the doctor. I think that was a Tuesday. I saw the doctor on a Friday.
Right.
So got right on it.
Yeah, that's fantastic to get going and absolutely tackle it head on. And as you've been going throughout these treatments, have you learned new things about your body that just have amazed you, that you're like, I didn't even know I was capable of that?
Yeah, I mean, the human body is amazing. And I just feel like people are resilient, and just seeing that with the patients as well, like the other patients. I mean, some of the treatments can be very hard, but I think with the right support and the right attitude, people do well.
I see the patients. We do lots of chemo education, lots of teaching when we're starting new treatment. I say everybody's journey is different, but having those support systems, those support people is excellent. Having an excellent care team makes all the difference. We have an excellent team of providers here at JCMG. Just being very open with your providers. Communication is key. Talking about how you're feeling about your body and so forth. Super important.
It is.
Of course. And what's kind of a big piece of advice or a big statement that you would like to make going forward as October continues, you continue to advocate for breast cancer awareness and patients who have breast cancer?
Well, in those who have not been diagnosed with breast cancer, but again, are concerned about a lump or bump, always have that checked. When in doubt, check it out. It's always going to be okay to ask to have it checked out. But once we have that diagnosis, again, just communication is key. Finding a care team that's comfortable for you, that you feel good working with. Having those support systems, power and positivity, power in your people, power in prayer if you're a person of faith.